Hi everyone, thank you very, very much for joining us today for Making Men's Health Count. Now this session is being pre-recorded, but we'll all be here watching today when you're finally getting to see this video, and any comments or questions that you have for any of us, you can pop in the notes section below. So today we're here to have an insightful discussion on innovation, funding and the future of men's health. And we'll be diving into the world of startups and biotech with a special focus on groundbreaking work in men's reproductive health. So we'll be covering the science and innovation behind Virilitas' mission, as well as overcoming funding obstacles as a Norwich-based startup. And we'll also share with you some actionable advice for founders navigating the startup journey. So joining us here today, firstly, we have Emilia Caporale, and Emilia is from St John's Innovation Centre in Cambridge. Welcome, Emilia.
Hi, Jen and Nick. Thank you for having me here today.
You're welcome. So Emilia is a former finance director at Accenture, and she's transitioned into strategic advisory for SMEs. So she recently joined the Innovation and Growth team at St John's Innovation Centre, which is of course home to a multitude of startups. And that team delivers Innovate UK business growth services across the east of England. And then of course with us as well today, we have Dr. Daniel Marcu from Virilitas Labs. Good morning. Hello, Daniel.
Hi, hello. Thanks for having me.
You're welcome. So Daniel, Dr. Daniel Marcu is a scientist and researcher in male fertility, and he holds a master's in prenatal genetics and fetal medicine from University College London, and of course a PhD in sperm biology and genomics from the University of East Anglia. He's also the co-founder of Virilitas Labs, which is, and we'll hear a lot about this in a few minutes, an innovative health tech company developing solutions to improve men's health and fertility. And finally, sitting beside me here is our very own Nick Cully. And Nick Cully joins us as well from the One Group, and he's from our accountancy and finance division. And Nick, hello, good morning.
Good morning.
Hi.
Good morning.
So Nick is a very, very experienced recruiter, and he's worked in the Cambridge accountancy market for over 26 years, is that right?
It would appear so, yes.
And Nick manages permanent and interim senior and board level appointments across Cambridgeshire and the whole eastern region. So I'm going to leave you, Nick, to ask the first questions to Emilia, I believe, aren't you?
I am indeed. Thank you, Jen. Good morning, Daniel. Good morning, Emilia. Hope you're well.
Yes, indeed.
Hi, yes, we're fine. Yeah.
Emilia, I just wanted to sort of remind myself, really, how you first came across the One Group.
Well, I came across the One Group because of LinkedIn and the so many jobs that you recruit for. So I thought you had a relevant presence in Cambridge, and I had to follow you. And thanks to that sort of connection, I think I was invited to the Women in Finance event that you organized, Nick, and that I enjoyed very much. It was we had insightful discussions in the room with the panelists. It was good for networking, and I had new nice connections after the event, including the one with you, Nick. So here we are today.
That's right.
Amazing. And so now we're going to obviously find out a little bit more about the science. So Daniel, can you tell us a bit more? Can you share a bit about your background and really what inspired you to start Virilitas?
Yeah, sure. Thanks for asking. So as you can tell, my background, both my physical one and my academic one, are quite nerdy, I would say. So I have a undergraduate degree in biomedicine. Then I did a master's in prenatal genetics and fetal medicine at UCL. And there I learned all about women's health and babies, but I learned very little around male fertility. So that really inspired me to actually dive a little bit more on the research side and actually contribute with knowledge into the field. So then I decided to take on a PhD in Sperm Biology and Genetics at the University of East Anglia. And so after my PhD, I took on a short postdoctoral position to continue some of my research that I started during my PhD. And so what I realized actually was that throughout my academic and scientific journey, I became increasingly aware of a glaring gap, I suppose, in our understanding around fertility, but most importantly, infertility. We know that infertility affects 1 in 6 couples, and we know that half of the cases are linked with male factor. Yet, for some reason, men have been largely neglected in terms of research, diagnosis, and treatment. And even the Bible around male infertility knowledge, which is the WHO manual, is built on data from just over 3,000 men across 12 different countries. And so this limited data set actually forms the basis for most clinical guidelines, which really just shows how under-researched the field truly is. And so I think it's hardly surprising that we know so little actually about male fertility or actually around fertility full stop. And when something is wrong around our reproductive health, it's generally a woman's problem. It's never our fault. It's never, the men's problem. And certainly this can be seen around diagnosis, whereby we're still actually using the same methods to assess male fertility and male infertility. We're relying on really archaic technology that has been developed in the 70s to assess this massive element of our lives. And so I think what really inspired me to actually build Virilitas was really the lack of research, the lack of data, and the lack of solutions around it. That plus a lot of the personal conversations that I heard from people who, despite actually very knowing me very little, they shared some of the most, I suppose, intimate aspects of their lives once I told them what I do. So I think a combination of these two elements probably was why we started Virilitas in the first place, actually.
Awesome. That's really interesting that it's 1 in 6 couples. And as you say, it really is quite a sort of taboo subject, or has been in the past. So it's awesome that you've created this. So can you walk us through the actual innovation part of it, what you're working on, and really which sort of specific problems that you're aiming to solve?
Sure. I'll probably start from the problem first, and then I'll walk you through our solution that we've been trying to work on in the past few years. So we often hear a lot about cardiovascular disease, for example, and diabetes and so on, but very rarely hear about infertility. And as I mentioned, despite the fact that actually 1 in 6 couples worldwide are affected by it, the subject is still considered a massive taboo. So we are essentially suffering a massive silent epidemic, which particularly men, whereby those affected by it, they don't talk about it, and as a result they don't get the help they need, and so much so that it actually takes about 3 years to be actually diagnosed with infertility and about 7 years to have a baby. And I believe that's a very long time to be spending on diagnosis and treatment. And this very much, I believe, is really the result of a combination of factors, including obviously the lack of awareness around the topic, but also not knowing actually where to turn and where to ask for help, and not being able to afford reproductive healthcare in the first place. So with Virilitas, what we are aiming to build really is a ecosystem of products and services that really empower men with insights into their fertility, but also insights into their health. So our first product is really an innovative self-testing medical device that provides key information and very detailed insights into male reproductive health by analyzing specific molecules into sperm and seminal fluid, without having to post samples back into a lab, or without men having to attend a fertility clinic and having specialized people actually looking down the microscope to analyze our sample. And we do that by using a combination of different cutting-edge technologies, such as molecular biology, engineering, and software, really, to give men a personalized reproductive health snapshots in minutes after sample production in the comfort of their own home and their own time, really. And so I really believe that it's really time to use cutting-edge technology that we have developed at universities to actually make diagnosis and treatment more accurate, more accessible, and perhaps more important, more affordable. And this is exactly what we're trying to do with Virilitas.
Yeah, so that kind of covers a little bit about the next question that I was going to ask you, making it more affordable. Do you think this is going to make quite a big difference in the industry, and obviously for individuals dealing with these issues? I mean, you mentioned affordability and doing it in the comfort of your own home as well, rather than somewhere more clinical. Is there anything else, other things that is going to make a difference?
Yeah. I mean, I truly believe that our approach is quite disruptive for the whole industry, for the whole fertility industry, because fertility ordinarily is assessed quite reactively. So most couples have to wait about 24 months to be referred to a specialist. And so what we're trying to do with Virilitas is really to shift the focus to early intervention, prevention, potentially even bypassing the need for costly clinical treatment. And so over the past years, by obviously working in the field and by talking to many men affected by infertility, what I know and what I came to realize actually, that our technology would really have a really profound impact into their lives, particularly because male infertility is still such a taboo subject. And so I'm incredibly excited actually that by using our technology, men will be armed with knowledge around where they stand and what they need to do to get where they need to be, essentially. And beyond actually testing and care, I do see our platform as an opportunity to actually transform how men perceived and manage their reproductive health and their fertility, so that male infertility, is no longer a taboo topic, but is rather part of normal health discussions.
Excellent.
That's really some really fascinating facts and figures there, and sort of the points you make around the small data samples and things like that are quite eye-opening, I have to say. But sort of moving on to sort of the commercialization side of things, Daniel, obviously you guys are based over in Norwich. Do you think that being based over there will make it more difficult for you to secure funding than, say, if you were based across in Cambridge, which is clearly biotech central?
Yeah, that's a great question. So Cambridge, obviously, it's undeniably a global hub for innovation, and it's got a highly concentrated ecosystem of startups, of investors, and obviously of resources. But being in Norwich doesn't actually mean that we don't have access to the same immediate visibility or access to the same networks, I suppose. In fact, I see this as an opportunity almost, because Norwich has a fantastic, scientific and business community, particularly at the Norwich Research Park and at the University of East Anglia. And so I think investors have already started to recognize this and are beginning to look beyond the golden triangle, which is really good. Yeah. And those that are not, they should really. And I think we are starting to see that change and that move. But ultimately, for our own purpose, we are building Virilitas to be really a global business. So for us, location really isn't a limiting factor. As long as we find the investors that resonate the most with our mission and share, I suppose, my obsession around using technology to address a massive global issue that affects 1 in 6 couples, then we're happy, actually.
Yeah, totally agree with that. Absolutely. And Emilia, obviously you've spent a large proportion of your career with Accenture, obviously a global corporate consulting business. What made you decide to complete sea change and sort of get involved and add value to the SME market and the early stage market, and how have you found that transition?
Yeah. So Nick, it all started with the redundancy program that Accenture put in place between 2023 and 2024. 19,000 roles were made redundant, and mine was one of them. After the initial shock, because it was a shock, I took it as a great opportunity for a new beginning. And it has been. So it all started from the entrepreneurship, women enterprise program at the Cambridge Judge Business School, where I contributed with a lecture and mentoring some of the participants.
Yeah.
And then I started collaborating as a strategic finance advisor with 3 startups, one of which is my beloved Virilitas. And now I have proudly joined the Innovation and Growth team at St. John's Innovation Centre. We are part of Innovate UK, and we support and help innovative small and medium enterprises to commercialize, internationalize, be investment ready. We help them to grow and scale, and at the end, to achieve their goals. Now, Nick, you asked how I found the transition from one sector to another. In the Cambridge and Norwich ecosystem, innovation ecosystem, I've found it smooth, and I've also found that lots of best practices developed inside a gigantic established corporation like Accenture are transferable and can be tailored to the needs of smaller organizations. However, I also found that larger organizations, at least when they hire for senior finance roles, prefer to hire people with years of experience in the sector, which is a barrier, in particular if you don't have any connection inside the organization.
Yeah, and that absolutely. I mean, you're a shining example of transferable skills, and that's often an obstacle that we have to overcome here as recruiters. Is that there is this perception that in order to move from one sector to another, there's that barrier that you can't. If you don't have experience, particularly within biotech, if you don't have the experience within biotech, then you're not relevant for a particular role. We here are absolute firm believers in transferable skills, and actually coming from a different sector and a different type of environment brings a fresh approach and fresh ideas. And of course, as you rightly say, within Accenture, you've learned some phenomenal disciplines and best practice, and governance, and all of that kind of thing, which you can have an impact on SMEs and early stage businesses that are looking for that type of discipline. So that's really fascinating. So thank you for that. We know, obviously, that both you and Daniel strong believers that preparation is the key to strengthening your position before you have those conversations with potential investors. So could you just sort of shed some light on how you've gone about that?
Yeah. Preparation is key to me always in life. So in this context, it keeps founders to articulate how they're going to translate their vision into execution and reality. So let me give some tips on how to structure initially the preparation. You need to understand your market, your customers, and your value proposition. And you need to understand how to originate demand and capture the demand for the products and services that you're bringing to market. This is your go-to-market strategy. Analyze your competitors and capture what your competitive edge is. Then you need to articulate how you're going to make money, which is your business model.
Yeah.
Identify the key risks and establish how you're going to mitigate them. It's very good if you can shape a vision on how to increase the value of your business, which may be having a vision for research and development, which will enable you to launch new products, new services, or having ideas on how you're going to expand horizontally or vertically. You need to organize everything in a roadmap. What you're going to do, when, which are the intermediate milestones and the critical milestone, which resources you need and which skills you need in order to achieve your milestone. It has to be more detailed for the short term and high level, medium and long term. And last but not least, you need to have a sound strategic financial plan.
Yeah.
So this is not a one-off exercise, it's a process. It's a recurring process because your thinking is going to evolve, and likewise, the context is going to evolve. So everything will be run and change over time. But what important is the process and the outcome of the process. At the end of the day, investors invest in people.
Yeah.
So what preparation will help you with is proving investors that you understand your business end to end, widely and deeply, that you've done your homeworks and you are reliable.
Yeah.
This is our belief.
That's really interesting and really, really helpful. And quite relevant, I think, Emilia. So I think you and I, obviously you met Nick at one of our Women in Finance events, and then I came across you, I think, previously back in autumn last year when we had the LinkedIn Live series, which was Science Startups. And you actually joined us on one of those, didn't you, where Paul Mantle was speaking with Remedium. And Paul was so good at giving some superb advice to anybody sort of starting on that startup journey. And now here you are since then, Emilia, doing some amazing things as well, you know, with those 3 startups that you mentioned, but also now with St. John's. So from that experience, Emilia, what similar or other pieces of advice could you give that you think could really help other startups? Yeah,
my advice is to think through the lenses of your customers. Why your customers will buy what you bring to market? Why will they fall in love with your products or services? Why will they recommend you to others? And how will they perceive the value that you bring them? It's their perspectives, not yours. This is a completely shift of mind. This helps to find the right market fit and to have a compelling customer value proposition. The earlier you do that, the better. That's my advice.
That's super useful. And Daniel, I mean, I first came across Virilitas Lab, so it was at Cambridge Tech Week, but last September, was it September?
Yeah,
you were there?
Yeah.
And I think it was the award that you guys won. Was it called the People's Choice Award, where you had to do a 90-second pitch, didn't you, to everybody in the Corn Exchange, and then people had to vote as to which of the 6 or 7 startups, and you guys actually won that, didn't you?
Yeah, exactly. And that was phenomenal, actually. I think there were many companies, and I think for us it was really an eye-opening, really, because it's a People's Choice Award, and for us being a consumer-facing brand and being a brand that and a company trying to solve a people's problem, you know, it's really kind of helping us build that traction and helping us being recognized by people that care about our mission and that care about actually solving this massive global challenge. So and you're up against some pretty tough competition there with the likes of Hutan Bio, who are getting well known now. So, and that's actually another company that we've previously recorded with and have given us some excellent advice with Paul and James. So really the same question that I just asked to Emilia, from your point of view, what pieces of advice or what main piece of advice could you give to other founders who are at a really sort of similar point in their journey to Virilitas? Yeah, I think one of the biggest lessons that I've learned, and one that I'm trying to still learn, is obviously to embrace uncertainty, because it's really part of this whole process. And the founder, obviously, you don't always have all the answers that you need, yet you still need to move forward. And I think another piece of advice, which I think ties into this first point, is to be resilient and be extremely resilient, because building a company, especially in the early stages, comes with many challenges. You know, whether it's a rejection from an investor or whether there's something not going as it should in the lab, kind of having that resilience is actually key to move the company and to move yourself forward. And I think that actually having a PhD comes really handy here, because over the past 5 years, I think resilience is probably the number one key transferable skill that I developed. And so for me, and I believe that for most founders, actually, the goal is really not really, it's the long, we are really focused on the long-term commitment and long-term goal as opposed to short-term wins. And so developing also that ability to fall and rise over and over again in the process is also extremely important.
Indeed.
really helpful. Resilience, and to do your PhD, I'm sure that you use a lot of resilience as well as a great sort of training exercise for what you're doing now. We've got so many questions we'd love to ask you. Unfortunately, we don't have enough time. Perhaps we'll have to do another one. But so just really to wrap this up. So what's next for Virilitas? What's next? What have you got to do now?
Yeah. I mean, we've reached a really exciting stage right now. So our immediate focus is basically on completing our development of the self-testing medical device and preparing for market entry. We are currently actively engaging with investors and partners to make sure we have the right backing. But beyond that, we've already started to look into how to expand this ecosystem of products and services that we are planning to build. And certainly we want to move more into interventions, and we want to move more into tools to improve the success rates of assisted reproductive technologies. And in fact, we already filed a patent into that space already. But I guess focus is everything. And so the priority for us really is the development of our first product, the self-testing medical device. And so we are currently dedicating all our time and efforts and resources to actually ensuring that we have an accurate, safe, and a regulated medical device ready to be deployed into people's home, hopefully soon.
Amazing.
Exciting.
Yeah. And I know, you're obviously both based over at the UEA, and there's some other companies over there that are doing some amazing things. I think you've got the Enterprise Tuesday once a quarter, isn't it, where it really gives you guys a chance to shine a light on what you're doing. So fabulous. Really looking forward to what the next few months look like for you, Daniel, and also Emilia. You and I are often bumping into each other in St. John's, aren't we?
Yes.
So I'm sure we'll be seeing and hearing from lots more from you. So just wanted to thank you all today for participating. This has been really sort of insightful, and I hope a lot of people can learn some useful gems of wisdom from you both. If anybody does want to get in touch, as I said at the start, this is pre-recorded, but we will be online when the video is released on LinkedIn. So any notes that you have, or questions, or just any points you want to raise with us, do pop them in the notes field below, and we'll get in touch with you. Or if you want to reach out to any of us on LinkedIn, that would be great as well. So just once again, thank you very much to everybody, and we'll see you soon.
Thank you, Jen and Nick. Bye.
Thank you, guys.
Bye.